Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled An Update to Guidance on Tobacco-Free and Tobacco-Limited Services. And our presenters are Kelly Grace, Senior Attorney for New York State OASAS, and Grace Hennessy, Associate Chief Medical Officer, Addiction Psychiatry, New York State OASAS. They will be joining us in just a moment. First, a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, and recovery services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, and recovery workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our presenters.
My name is Dr. Grace Hennessy. I am the Associate Chief Medical Officer for Addiction Psychiatry for OASAS. And this afternoon, during this hour, our goal is to review the guidance on tobacco-free and tobacco-limited services that goes along with the updated 856 regulations that changed the title of the regulations and the content from tobacco-free services to tobacco use in adult services. So I am going to first introduce Kelly Grace, who is a senior attorney with us at OASAS. And she's going to review the first slide that talks about these changes.
Hi, everyone. So like Dr. Hennessy said, my name is Kelly Grace. I'm one of the newer attorneys in counsel's office here at OASAS. So I might have virtually met a handful of you, but you're probably more familiar with my coworker, Carmelita Cruz. I'm slowly learning the whole OASAS regulatory process from her and starting to take on some more of the regulations. So you'll probably see a little bit more of me. When it comes to Part 856, we worked really closely with the medical team, Dr. Ramsey and Dr. Hennessy, and these changes are really on board with the overall goals of the agency with respect to moving towards a more patient, individual-centered focus of care. And here, what that looks like is kind of balancing patient autonomy and this patient-centered approach with health and safety considerations of all of the staff and patients. And just kind of remembering that recovery looks really different for everyone. Every human is different, and sometimes they're not ready to give up all of the things, and that's okay. And we're trying to really make moves to meet them where they're at, and also making sure that there's a solid plan in place to assist them in working towards giving up tobacco. So that's kind of the theory I like to think about when looking at the regulatory changes we made in Part 856. I will make this super brief because I know what everyone really wants to hear is information about the new guidance documents from Dr. Hennessy. So the changes, the proposed rule was published back in October 2021. We presented it to the Behavioral Health Services Advisory Council. They recommended that it move forward as a proposed rule. We received public comment. We assessed the public comment, made a few changes along the way, and then published the rule in late winter 2022. It appeared in the March 9th issue of the State Register, so it is now in effect. It's posted on our website. I believe the guidance documents are posted as well. That's all up and running. And to kind of go over some of the big changes here, In the applicability section, we basically changed the language to specify that the tobacco limited provisions of this regulation apply to prevention, treatment, recovery services for adults, and then not for services for children and youth, young adults, as well as made it clear that this regulation does not mandate that you become tobacco limited. You're free to remain tobacco free as well. In the definitions section, we have some new definitions and then just some revised definitions. We have a tobacco limited definition, tobacco free definition that are pretty self-explanatory for the most part. We revised the definition of facility, included a definition for facility grounds. The definition for tobacco products, I think, slightly changed, and it now reads include but not limited to cigarettes, cigars, pipe tobacco, roll your own tobacco, and smokeless tobacco. And then nicotine delivery systems, this definition was included, and this means any electronic or modified mechanical devices that deliver aerosol nicotine flavorings and or chemicals by inhalation of a non-combustible liquid or gel, and any refills, cartridges, or other component of such devices. And then the most important change that I think is part of this regulation is, of course, the policies and procedures, which is a little bit more lengthy. And that's kind of going to be, I think, the main focus of what we discussed in this webinar is really related to the guidance for a tobacco limited environment versus a tobacco free environment and what that actually looks like for programs. So, you know, this used to be kind of pretty basic. Everything was tobacco free. So policies and procedures really just had to do with methods of governing that tobacco free environment. So now that could look quite different for a program that chooses to become tobacco limited versus a tobacco free program. And I think with that, I'm going to pass it over to Dr. Hennessy to get into what everyone really wants to hear about, and that's the guidance.
Thank you very much, Kelly. I appreciate you going over that. So for the rest of this, we will talk about the guidance. I'm just going to go through the provisions of the guidance, and then we'll take your questions at the end. I can't see the questions because I have my PowerPoint up, but we will address them at the very end. We do have some learning objectives for this review today. So it's to understand the common requirements for policies and procedures for tobacco-free and tobacco-limited services and OASAS certified programs as they relate to restrictions on tobacco and nicotine delivery system use, trainings about tobacco use disorder and its treatment, screening and assessment for tobacco use and tobacco use disorder, treatment of nicotine/tobacco use and tobacco use disorder, communicating program policies and procedures. Second point is understanding the additional requirements for policies and procedures for tobacco limited programs as they relate to use of cigarettes on facility grounds, cigarette tapering protocols and nicotine dosing administrations, cigarettes, lighters, and matches. And lastly, describe the process for submitting an attestation form for approval to become a tobacco limited program. So first point I want to make is that all inpatient, residential, and outpatient programs located in or on the grounds of hospitals or medical centers must continue to follow the tobacco use policies and procedures of the hospital or medical center. So DOH supersedes us with this. Whatever they say, it can be done with tobacco products on their property is their right. So please, if you fall into this category, you still need to follow what the DOH says. So in terms of aspects of tobacco-free and tobacco-limited services that have some overlap. So let's just say first, as Kelly already mentioned, even though we've changed the tobacco-free services to allow the limited use of certain tobacco products in OASAS programs, it is for adults only. Services can remain, or if you decide to become tobacco-limited down the line, you can return to tobacco-free in accordance with the New York State Public Health Law. The age 56 tobacco use in adult services does not apply to prevention, treatment, or recovery services for children, adolescents, youth, and or young adults. These services must remain tobacco-free. and all OASAS certified, funded, and otherwise authorized services for adults that choose to become tobacco limited, remain tobacco free, or return to being tobacco free, and all prevention, treatment, and recovery services for children and adolescents, youth, and young adults must create and revise written policies and procedures to be consistent with the following. So the next bunch of slides are things that most of them apply to both tobacco-free and tobacco-limited services. So in terms of restrictions, the policies and procedures must prohibit the use of all tobacco products and nicotine delivery systems by patients, all staff, volunteers, family members, and visitors in facilities, on facility grounds, and in vehicles owned and operated by the programs. We will get to the point where patients are allowed to use on facility grounds, but just for ease of making slides and going over this, I included them here, but we will talk about where patients are allowed to use cigarettes in the next section. Tobacco products include, but are not limited to, cigarettes, cigars, pipe tobacco, loose tobacco, roll your own tobacco, and smokeless tobacco. And OASAS reserves the right to revise the definition of tobacco products at any time. Nicotine delivery systems are any electronic or modified mechanical devices that deliver aerosolized nicotine, flavorings, and or other chemicals by inhalation of a non-combustible liquid or gel, and any refills, cartridges, and or other components of such devices. FDA-approved nicotine inhalers that are prescribed to a patient for the treatment of tobacco use disorder do not fall under the NDS definition that was raised with us, that by having this saying people could not use NDS, we were eliminating nicotine inhalers. So we are allowing for prescribed FDA-approved nicotine inhalers to be used by patients for treatment. And OASAS reserves the right to revise the definition of NDS at any time. Policies and procedures need to define the parts of the facility and vehicles where all tobacco and NDS use is prohibited by patients, all staff, volunteers, family members, and visitors. The policies and procedures must prohibit all staff and volunteers from purchasing tobacco products or NDS for patient, family members, or visitors, giving tobacco products or NDS to them, using tobacco or NDS with the same group, and giving matches or lighters to patients, family members, or visitors. In terms of training, all programs are required we require clinical, non-clinical, administrative, and volunteer staff to receive evidence-based training about screening and assessment for tobacco, nicotine use, and tobacco use disorder, the effects of tobacco and nicotine on physical and mental health, counseling for reducing harm from and cessation of tobacco and nicotine use, and medications for the treatment of tobacco, nicotine use, and tobacco use disorder. Policies and procedures will require that staff receive trainings when newly hired and annually, and programs must retain a log of all staff trainings. In terms of screening and assessments, the program should include screenings, questions about tobacco use and nicotine use in their intake forms for the program. It should screen for current and lifetime tobacco use using evidence-based screening instruments as part of the initial admission assessment and every 6 months while the patient is admitted to the program. Assesses tobacco nicotine use and tobacco use disorder using evidence-based assessments if the screen is positive. Documents the results of screenings and assessments in the patient's record. Documents tobacco/nicotine use or tobacco use disorder and diagnoses, problems list, progress notes, and treatment plans. In terms of treatment, the policies and procedures should specify that the program provides evidence-based individual and group treatments to patients that are aligned with their level of motivation to change their tobacco and nicotine use, provides a standardized group curriculum about the physical and psychological effects of tobacco and nicotine, provides a standardized group curriculum for the treatment of tobacco use disorder that uses evidence-based interventions for the treatment of all substance use disorders, such as motivational interviewing or relapse prevention. Provides FDA-approved medications for the treatment of nicotine withdrawal, nicotine craving, and tobacco use disorder, and provides written information about these medications to patients, documents the patient's response to individual, group, and pharmacologic treatments for tobacco nicotine use or tobacco use disorder in the patient record, documents the patient's response to individual, group, and pharmacologic treatments for tobacco nicotine use or tobacco use disorder in the patient's record. Includes discharge planning and resources for aftercare that allow the patient to continue working towards a tobacco nicotine-free life by maintaining the gains made in reducing or ceasing tobacco nicotine use while in treatment. and describes employee assistance programs and other programs that will be made available to any staff who want to stop using tobacco products, NDS, or other nicotine-containing products. So this is a slide, if you notice the color on the top change, this is just a slide particular for programs that are tobacco-free and want to remain tobacco-free. So just a communications where it describes how describes how patients, staff, volunteers, family members, and visitors will be informed of the tobacco-free policies and procedures, including posted notices and provisions of copies of the policy. OASAS certified, funded, and or otherwise authorized services for adults that remain tobacco-free and services for children, adolescents, youth, and or young adults are not required to complete an attestation verifying that they have fulfilled the requirements of the tobacco-free guidance. We do hope that that all the programs are abiding by hopefully all of these, but at least most of these, and that if you remain tobacco-free, you will continue to do that, and we will not require that you attest to us that you are remaining tobacco-free. However, OASAS will reserve the right to review a program's tobacco-free policies and procedures at any time to ensure that they are being followed. So this little table just reminds you that there are a lot of the sections are the same. So in terms of the sections that we just went over, training, screening and assessment, and treatment for both tobacco-free and tobacco-limited programs are exactly the same. So you should be carrying all of that out. There are some differences and restrictions, which we will go over. And essentially communications is the same. The only difference in that communication statement that was on the last slide was that between tobacco-free and tobacco-limited is that in tobacco-limited services, it describes how patients, staff, volunteers, family members, and visitors will be informed of the tobacco-limited policies instead of the tobacco-free policies. So moving on to the tobacco issues with the tobacco-limited policies. So restrictions has two other items in tobacco-limited services. So it prohibits all paid, unpaid, and contract staff and volunteers from using tobacco products or NDS when they are in the program facilities, on facility grounds, or in vehicles owned and operated by the program. So no use at all by those individuals on anywhere with the program. And also the policies and procedures need to prohibit advertising on all media platforms, on program websites, and program brochures, flyers, and other printed material, and during prepared presentations about program services that the program allows the limited use of cigarettes. I'll answer an obvious question right now. If someone asks you unsolicited, do you allow cigarette use in your program? You can answer that question. We're not saying you can't. We just are saying that you can't advertise in any way or in any way that you present the program that you allow for the limited use of cigarettes. So this is additional criteria for inpatient residential, intensive and community residential, and residential stabilization, rehabilitation, and reintegration congregate. So if you run a program that falls into any of this, keep paying attention. If you're outpatient or scatter site programs, we're going to get to that in a minute. So this is for these programs in particular. So in terms of facility grounds, the policies and procedures will allow for the limited use of cigarettes only by patients in designated areas on the facility grounds at designated times. It will identify and designate an outdoor area on facility grounds where patients only may smoke cigarettes. The outdoor designated smoking area must be 100 feet from all entrances, and OASAS will not incur any expenses to create a new space for this purpose. Policies and procedures should prohibit all staff, volunteers, family members, and visitors from using tobacco products and NDS in program facilities, in program vehicles, and on program grounds, including the outdoor area where patients only are permitted to smoke cigarettes. Implement standardized cigarettes tapering protocols that decrease the number of cigarettes smoked daily by a set amount at set intervals during the admission, with the goal of significant reductions in or cessation of cigarette use. So one of the things that came up as we were working on moving towards allowing for cigarette use on the programs was really having to have this not just be really that people can smoke when they want to, but there has to be a treatment aspect to it. So this is the part about the cigarette tapering protocols and nicotine dosing administration. So as I just mentioned, there is going to be expectation that you're tapering the number of cigarettes that people are using. I'm going to give some examples in a minute during their admission with the goal of reducing harm. So second point, patients who smoke cigarettes or use other tobacco products but choose not to be placed on a cigarette tapering protocol will receive treatment for tobacco use disorder but will not be able to smoke cigarettes during their admission. Patients who solely use nicotine delivery systems will not be permitted to smoke cigarettes and will receive medications for the treatment of nicotine withdrawal, nicotine craving, and tobacco use disorder. And patients may not be prescribed FDA-approved nicotine delivery systems other than nicotine inhalers. There is no others that are available right now, but we're putting that provision in there in case things change down the line. The programs will schedule nicotine dosing administrations. You don't have to call them this, but this is what we call them, or NDAs, consistent with the standardized tapering protocols. And the goal of the nicotine dosing administrations will be for the patients to receive a dose of nicotine by cigarettes. There should be no more than 10 of these periods a day. There can certainly be less. The time to smoke the cigarettes will last for no more than 5 minutes. And by limiting the total time for nicotine dosing administration, the message is reinforced that the time is to be used for nicotine dosing only and is not for socializing. So the goal is sort of taking some of the fun out of cigarette use. And the schedule of nicotine dosing administrations will be for set times each day, cannot be arbitrary, and cannot be during scheduled group or individual sessions. And it requires that a staff member remains with the patients during the scheduled nicotine nicotine dosing administrations. This is also in the guidance, and it's also spelled out a little bit better in the guidance, but this is an example of a cigarette tapering protocol. People may know that Cornerstone and Horizon have been engaged in a tobacco demonstration project for many years. So this is an example, and I thank our friends at Cornerstone for letting me plagiarize their manual. So this is an example where individuals are divided into different levels of smoking. So heavy cigarette smoking, I think you can read it yourself, very heavy, moderate, and mild. And then there's a level for no cigarette smoking, use of other tobacco products, or use of NDS. And then some programs identify the levels by bracelets, name tags, or color bracelets. It's up to the programs to decide how they may want to identify people in the different levels. And then this is a tapering schedule. So the taper will start at the level appropriate to patients' daily use of cigarettes at the time of admission and will gradually decrease the number of cigarettes per day to 0 or the lowest number possible based on the length of the patient admission. So the people in level 1 would start at 10 cigarettes per day for 7 days, then go down to 8, 6, 4, and so on. And then if you come in at level 2, you start at 8 and you decrease from there. So again, if you are using other tobacco products and or nicotine delivery systems other than the nicotine inhalers, you won't be allowed to smoke cigarettes, but you'll get the other treatment. This is also in the guidance, so but wanted to highlight it here so people understood that there is the expectation that people are tapered down on their cigarettes during their admission. Okay, so going back to other issues, again, for inpatient residential, and so forth, as you can see, in terms of cigarettes, lighters, and matches, it prohibits patients from using nicotine delivery systems and tobacco products other than cigarettes, accepts only closed and factory sealed packages of cigarettes that the patient has brought to the program, limits tobacco products that family members and visitors can bring to patients admitted to the program to closed and factory sealed packages of cigarettes, prohibits patients from selling or sharing cigarettes with other patients, prohibits patients from trading cigarettes for goods or services, prohibits staff from using cigarettes as an incentive or a reward, establishes procedures for maintaining each patient's cigarette supply and distributing predetermined cigarette allotments per the patient's cigarette tapering schedule, provides and monitors matches or lighters that are held by the program and used to light cigarettes during nicotine dosing administrations, prohibits patients from bringing matches or lighters to the program or having them in their possession during the admission to the program, and prohibits family members and visitors from giving matches or lighters to patients. So for those of you who are running programs that are supportive living, residential reintegration, and scatter site and outpatient programs, obviously we can't have the same types of restrictions in these programs. It's a little harder to control what people are doing. There's not set activities and set times. And there are obviously, but people go home at night with outpatient programs, or they're doing other things if they're at a supported living program or residential reintegration and they're working. So what the expectations will be if you are allowing patients to smoke on program grounds, they must abide by the same issues of facility grounds that we've mentioned before. So identify and designate an outdoor area on program grounds where patients only may smoke cigarettes. It must be 100 feet from all entrances, and OASAS will not incur any expenses. And the same prohibition for staff, volunteers, family members, and visitors from using tobacco products on the grounds in the program, and including the designated smoking area. For programs that are interested in offering tobacco limited service, you must submit a form attesting that your program's policies and procedures meet the criteria outlined in this guidance. If you go to the OASAS legal page, the guidance, if you read the guidance for the tobacco limited services, there is a link in there. But honestly, if you're on the guidance page, it goes TobaccoFree Services, Tobacco Limited Service, and then the attestation. You will need to meet all these criteria. You need to check off, for those of you who are familiar with the medical withdrawal protocols, attestation form that OASAS requests so that programs can assure that they are doing medical withdrawal protocols appropriately. We do ask for that, it's a similar process. It's a little bit longer, the form that we have there, but it's a similar process. OASAS retains the right to review a program's tobacco limited services, policies, and procedures at any time. If the policies and procedures are out of compliance with the guidance criteria and/or do not meet the standard of care for any reason, OASAS retains the right to request revisions and to initiate regulatory action as necessary and appropriate. And just for all programs in terms of trainings, if you were curious about where you might get some good trainings, the Center for Practice Innovation, CPI, which you should have access to, offers a wide array of free trainings in tobacco use disorder that satisfy the provisions of this guidance that programs can use for their staff trainings. We do not ask you where you get your training. So if you have another great way that you have been training staff or doing training programs for people to do groups or individual counseling for tobacco cessation, that's fine. We're not looking into that. I'm just offering this out as a suggestion.
I want to thank our presenters for today's program. I hope you will all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us to know if we are meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation. Once again, thank you for joining us and keep up the good work.